Good evening, everyone. We'll just wait a minute or two while everybody still joins the webinar, and then we'll kick off. Okay, I think we may as well make a start. Good evening, everyone. It's my very great pleasure to welcome you all tonight to the webinar on building positive body image in people with chronic illness. I'm Professor Ian Walker. I'm Director of the Research School of Psychology at the Australian National University. We start tonight by acknowledging and celebrating the first Australians on whose lands and airwaves the Australian National University operates, and pay our respect to the elders of the Ngambri and Ngunnawal people, past, present, and emerging, and indeed welcome any Indigenous attendees tonight. The Research School of Psychology at the ANU is a teaching and research school committed to excellence in psychological science and translating this to improve people's lives and to address problems in the world today. Our work spans the range of psychological applications from cognition and perception to social and clinical and health psychology. And our webinar tonight draws from the expertise of researchers and clinicians within that latter group, the clinical and health group within our school. Tonight's webinar forms part of the Building Positive Body Image program, a partnership between the ANU Research School of Psychology and the ANU Psychology Clinic. The program aims to promote positive body image in adults with a chronic illness and increase community and professional knowledge and awareness of body image through events like this one. We would like to thank the ACT government who support the Building Positive Body Image program under the ACT Health Promotion Grants. And we would especially like to acknowledge those from the Health Directorate who are present here tonight. Before I introduce our speakers, there's some brief housekeeping information to cover. You've all been muted upon entry to the webinar. The webinar tonight is being recorded and it will be made available on the ANU Psychology YouTube channel later on. We will have some time for questions at the end, and you can put your questions in the Q&A box at the bottom of the screen. We may not get time to address all of these, but any we don't, we will note down those and aim to address them in future webinars and other information sessions. Tonight's webinar is the first of 3 planned over the next 18 months in this field. And we welcome your feedback and suggestions to inform these education seminars in future. A link to provide feedback will be posted in the chat at the end of the webinar. We do encourage you to complete this. Tonight we have 3 speakers from the school. Dr Kristen Murray, who is a senior lecturer and clinical psychologist, Associate Professor Liz Rieger, who is also a clinical and health psychologist, and Ms. Jane Ma, who is a project officer and clinical psychologist. And with that, I'd very much like to hand over to Kristen to kick off tonight's proceedings. Thank you.
Thank you, Ian. It's a great pleasure for all of us to be here tonight to talk about a topic that is really important in our community, but also very important in the research and practice that we undertake here in the Research School of Psychology. So to get started, we just wanted to highlight the context of the presentation tonight and why we felt this would be a really important topic to share with the community. And we know from research, so the National Health Survey, which was undertaken in 2017-2018, that many people in Australia experience chronic health conditions. And the statistics suggest about 1 in 2 Australians will experience at least one chronic health concern. And many people indeed experience more than one. And these concerns can have impacts on people in their physical health and well-being, but also impacts on their emotional and mental health as well. So many people with a chronic health concern might be experiencing distress or stress as a result of managing that condition. And what we know from the National Health Survey is that there are many different conditions that people experience, and the most common include things like diabetes and cardiovascular conditions, osteoporosis, asthma and chronic obstructive pulmonary disease, as well as arthritis, pain, and also mental health concerns as well. And the management of these conditions will include a range of different strategies or treatments in order to optimise health and well-being. And often what we focus on in some of these conditions is helping people manage, so identifying their symptoms and knowing how to manage their symptoms, and often improving their lifestyle or changing their lifestyle behaviours, things like their dietary intake or exercise. So there's quite an important role for psychology in helping us understand what factors might help support people in self-managing their chronic health concerns, and ways that we can optimise their health and well-being for the longer term. One of the impacts, though, of chronic illness that isn't well understood, or at least hasn't received the attention that perhaps we would hope it would, is body image. So many people with a chronic illness have more negative body image, and we'll be talking about this more as we go through tonight. And we know body image plays a role in health and well-being. So body image might be a really important target for us to promote and support individuals with a chronic illness in living healthy and fulfilling lives. So tonight in our webinar, we really wanted to share some information to really help people understand what body image is and how it might be impacted in somebody with a chronic illness, and some of the ways we might think about promoting positive body image to promote health and well-being in this population in particular. So I'm going to get us started talking about what body image is, and then I'll be handing over to Liz to talk a bit more specifically about body image in chronic illness. So when we decided to do this webinar, one of the things we really wanted to talk a bit about was what body image is. And so what we mean by that as researchers, but also clinicians. And the reason for that is because there's quite a bit of attention on body image in community, and that's great. It's a really important topic. But often we talk about body image in really specific or narrow ways. And actually, as a kind of concept, it's quite a diverse and complex concept for us to be talking about in our work as researchers or clinicians or in the community. So what we wanted to do was to talk a bit about what it is and to help provide a bit of context for what we're going to be talking about with respect to chronic illness in particular. So if we think about body image in general, what we really are talking about is the way we relate to our physical self. So that will include the way we see our body, the way we think and feel about our body, but also the behaviours that we might engage in with respect to our body. And that can be undertaken around a range of characteristics. It could be the body as a whole, it could be specific body parts or bodily attributes or characteristics. And it's really important to flag that body image is actually something that's subjective, it's personal to us. You can't necessarily make an assumption about how someone feels about their body based on objective characteristics we can observe, because it's actually about the way we interpret our body or our bodily experience that determines our body image. And of course, we all have a body image. And there are a number of different factors that can impact upon the way we feel about our body or the behaviours or thoughts that we have about our body. And of course, tonight we'll be focusing quite specifically on chronic illness. But we did want to acknowledge that there are a range of other influences over time, but also influences in the moment that might change the way we're feeling about our body at that time. And the most prominent ways we think about this, according to our cognitive behavioural theory, which informs the interventions or strategies we might use to improve body image, highlights 4 key areas that we wanted to acknowledge, noting we'll talk specifically about one area tonight. So there are a range of different cultural norms and ideals, and of course we would all be well aware of the kinds of messages that we receive around what an ideal body looks like or what an ideal body might do. And those might be communicated in the media, but also in our relationships with others or our interactions with other people. And of course, those messages really impact upon the way we might evaluate our own body or how we feel about our body, and have an impact then on the body image that we might then have. So those cultural norms play a really important role in kind of giving us information about what an ideal body might be based on our cultural norms and ideals. There are then, of course, interpersonal influences, which include the communication of those ideals, but also comments that might be made about our body, whether well-intended or not, that can then impact upon the way we feel about our body. But it is important to note there can be really positive influences as well. So having relationships where we feel like our body is accepted and we're supported actually has a really positive influence on the way we feel about our body as well. We also then, of course, have our physical characteristics. So while it doesn't determine the way we feel or think or behave in relation to our body, the physical characteristics or objective qualities of our bodies can impact upon the way we do feel about our body or our body image. And chronic illness, of course, is one of those because it includes changes in those characteristics, but things like our weight or our shape can also impact upon the way we then feel about or evaluate our body in our life. And finally, personality characteristics can also influence the way we more broadly think or relate to our body. So things like feeling good about ourselves in general, having high self-esteem can result in more positive feelings about the body in general. When we were thinking about what we wanted to share about body image, there were three key distinctions that we really felt would be helpful for us to focus on as part of our discussion tonight. And this will help also frame our discussion around chronic illness. So I'll now kind of walk you through three kind of key distinctions that are important in the body image field. So the first distinction is that body image is multidimensional, and by that we mean it has a lot of different components. And I'm not going to be able to talk through all of those this evening, but there are two key components of our attitudes towards our body that we wanted to acknowledge. The first part of body image is around our evaluations of the body, and by this we're referring to the way we feel about our body essentially, so whether we like or dislike our body. And when we hear terms like body dissatisfaction or body image concern, which is really commonly talked about in our community, this is really what we're referring to, this evaluation component. But there is actually another really important component of our attitudes towards our body, which refers to our body image investment. And what this is actually getting at is how important our bodies are, both to ourselves, but how important they are in our life, and also the impact that our bodies and our evaluations of our body have on our self-worth. So if our bodies are really important determinants of the way we feel about ourselves more broadly, that would be an indication of high levels of body image investment. And so the way that we think about body image can include lots of different components. So it's not the case that body image is just body satisfaction or dissatisfaction. That's one part of a bigger concept or construct. The second distinction we wanted to make is around the domains in which we can focus on in terms of our body image evaluations or investment as examples. And the first is the aesthetic components of the body, or what we look like. And most often this is what we talk about when we talk about body image in the community and in research, but also practice. And that's a really important part of the way we feel about our body or the relationship we have with our body. And so that might mean we're referring to evaluations or investment related to aesthetic attributes like our weight or our shape or our muscularity. And this, of course, has implications for a number of different health outcomes that you've probably heard of previously. So things like disordered eating often have an association with how we feel about our appearance, but it's not limited to that, and we'll talk about that in a moment. What's important to acknowledge, though, is our experience of our body isn't limited to this aesthetic component. And in fact, our body image includes how we feel about what our bodies do or don't do, and our body functionality more broadly. And by that, we're talking about things like our capacity to engage in movement, our ability to communicate with others, the sensory experiences that we have, so things like pleasure or pain or being able to see or hear what's going on around us, the health and internal processes that occur in our body, but also characteristics like our ability to think or concentrate, so sort of cognitive processes. And so our body image incorporates the way we feel or think or behave about both of these areas. And so our experience of the body is more broad and not just limited to those aesthetic components. And that's particularly important when we're talking about body image in chronic illness, which Liz will elaborate on shortly. And the final distinction we just wanted to make wanted to share with the audience tonight is around negative and positive body image. So most often when we talk about body image, we're talking about negative components, and that's because often the focus is on things like body dissatisfaction or body image concerns and their impacts on health and well-being. And so negative body image really is about having critical appraisals of the body, so feeling badly about the body. It might mean that we're overly invested in the body and determining our self-worth. And this is really commonly spoken about, but can focus on both aesthetic or functional attributes and includes both evaluative and investment dimensions, as we spoke about earlier. And what we previously considered in both research and practice is that negative body image and positive body image kind of sat on two ends of one continuum. So if you had low levels of negative body image, we would assume that somebody had high levels of positive body image. So you're not feeling bad, so you must be feeling good. But more recently, research has suggested that's not necessarily the case. And so the way we think about positive body image now is that it's separate from negative body image. You can have high levels of negative and positive body image at the same time because there may be a multitude of different things you're focusing on. And positive body image really is about relating to our body in a way that looks after our body, that protects our body and nourishes the body, that respects our body and accepts its limitations, accepts its imperfections, and also appreciates and celebrates all of the wonderful things our bodies do in our life. So it's not just the upper end or lower end of negative body image. If we think about a continuum, it's actually different and distinct and important in its own right. And often our focus is then on reducing negative body image when promoting positive body image simultaneously. We also just wanted to flag why body image is important in general. And there is quite a lot of data that suggests that many people have concerns around their body. So this is data out of the United States. About 60% of men and 46% of women who were surveyed in this particular study were satisfied with their overall body. And those statistics change depending on specific attributes they might have been focusing on. But it really suggests that many people could benefit from improvements in body image. And some of the concerns that have been raised in research in particular is that the frequency that we see negative body image in the community is worrying. It's led to this term called normative discontent that is really acknowledging that it's a particularly common problem, but that doesn't necessarily mean it's not something we would want to change. And we have a really strong rationale for why that might be helpful. So negative body image is a risk factor for a range of outcomes in health and well-being that are of concern. Things like disordered eating in particular, where much of the research has been undertaken, but also depression, particularly in young people. And there's also evidence that negative body image is associated with health depleting behaviours or behaviours that may not be very good for our health and well-being. So things like smoking as an example. On the flip side, positive body image is associated with positive outcomes. So it's recognised as a protective factor that might be good for our psychological well-being. It's also positively associated with health behaviours or eating in line with the needs of the body, engaging in physical activity. And so it's actually really important for us to be thinking about reducing negative body image and promoting positive body image in the community to really optimise health and well-being in the population. And as I finalise this part of the webinar tonight, we just wanted to acknowledge some of the work that's being undertaken in research, which really highlights the importance of body image as a target in public health. And because of the consistent evidence that we have in the literature around the impacts of negative body image on people's well-being, there's been advocates suggesting we need to have body image recognised as a public health priority because of those impacts. And so we really wanted to share that tonight as a rationale for why we think this is important for us to be discussing. And I'm now going to hand over to Liz, who's going to speak specifically about body image in chronic illness.
Thanks so much, Kristen. So there's actually a really large body of research that's been conducted on body image, but it's overwhelmingly been focused on negative rather than positive body image. And in terms of the psychological and medical conditions that have received the bulk of this interest, it's largely been in the area of eating disorders. Male body image has been relatively neglected compared to female body image, although that's changing with the recognition of muscle dysmorphia. But also older people have, and their body image has been relatively neglected compared to younger people. And as we're talking about today, chronic illness has been neglected in this field. So there was, to give you just a concrete example of this relative neglect, in 2019, a meta-review was published that looked at 60 systematic reviews on cancer and adult survivors. And it found that only one of these 60 systematic reviews focused on body image as the main theme. And it led these researchers to conclude that there really is an evidence gap when it comes to body image in chronic illness. And even though this meta-review was focused on cancer, I would suggest that the evidence gap in looking at body image in chronic illness is even more stark when we think of other chronic illnesses. So chronic illness and its management are known to result in changes across the bodily experience. And I'll just look at each of these dimensions in turn to give you some examples. So in the appearance or the aesthetic domain that Kristen mentioned previously, I'm sure we can all think of examples of how chronic illness and its treatment can negatively impact people's perceptions of their appearance. Appearance can change quite markedly as the result of a chronic illness. For example, alopecia or hair loss in the context of cancer treatment. The chronic illness might result in marked changes to a person's body weight. They might lose a body part through surgery, such as mastectomy, or have surgical scarring. People might develop lymphedema, where they can have marked swelling of their arms and legs from damage to the lymph nodes. Or in the case of rheumatoid arthritis, people's hands or feet might be quite affected by the chronic inflammation in the joints in their hands and feet. So they're just a few examples of the way that appearance can change in the context of a chronic illness. There's also the functionality dimension that again Kristen mentioned before. So this is when the person's bodily functions have been impaired as a result of the person's illness or its treatment. And so examples here might be for women, premature menopause. For both men or women, there might be impaired fertility, or impaired sexual function or sexual satisfaction. Women may no longer be able to bear children if they have a hysterectomy for some form of gynecological cancer. There might be chronic conditions that result in quite marked fatigue or pain, such as migraine, which makes it really difficult for people to complete their everyday tasks. Other conditions might be associated with impaired mobility. For example, if we think of a condition like ankylosing spondylitis, which can involve fusion of the vertebrae, which is not only painful but can make bodily movements very difficult. Or laryngeal cancer, where a person might have a laryngectomy where their larynx or their voice box is removed, which has marked implications for the person's capacity to speak. So again, they're just a few examples of how bodily function might be impaired. And then there's this dimension of dependability. So how dependable or trustworthy we find our bodies, which again can be challenged in the context of chronic illness. If the illness was of a life-threatening nature, for example, people might feel betrayed or let down by their body, or they might experience an increased sense of physical vulnerability or frailty. So some of the key findings of the research that has been conducted to date on body image in chronic illness is, not surprisingly, the research indicates that people with a chronic illness do indeed have higher levels of negative body image and or lower levels of positive body image. And that's been demonstrated across a wide range of chronic illnesses. We've just listed some of the main conditions that have been a focus of this research here. And we know that for people with a chronic illness, body image can be disturbed across the lifespan. So studies have found that body image is significantly worse in children, adolescents, and older adults with a chronic illness compared to their peers that don't have the health condition. And as I said in the previous slide, body image can be disturbed across the dimensions of appearance or aesthetic dimension, the functionality dimension, and also the dependability dimension. Body image disturbance is a concern because we know that it can negatively impact on people's emotional well-being, but it's also a concern because of this potential negative impact on people's capacity to engage in health-promoting behaviours that Kristen was alluding to before. And many chronic illnesses, their management involves a really important component of people engaging in health-promoting behaviours such as healthy eating or engaging in some moderate, regular levels of physical activity. And this is why body image is a concern. So chronic illness, as we've been saying, negatively impacts on body image. That negative body image can in turn result in emotional distress. For example, people might feel a level of body embarrassment or shame, or anger at the changes that their body has undergone, or a sense of sadness or grief. And those negative emotions could trigger emotional eating, for example, that could in turn have a negative impact on the person's health and well-being. Or people will sometimes say, who are experiencing body image disturbance, that it impairs their motivation to look after themselves, that it's difficult to care for a body that you don't particularly like or don't particularly care about. So those kinds of interactions in which negative body image can actually result in less than optimal management of a person's chronic illness, again underscore the importance of intervening in body image. But there's also positive news. It's not all bad news. So there is research indicating that people with chronic illness can indeed have a positive body image. This is a recent study that I'm using as an example here by Thornton and Lewis Smith. This was a qualitative study in which they conducted interviews with women who had survived breast cancer, and the focus of the interviews was on the overarching theme of positive body image. And through these interviews, a range of sub-themes emerged that indicated how the women had protected their body image, and in some instances even enhanced their body image in the context of the challenges of cancer. So one of the themes that emerged is this notion of, but that's not real life. So what this theme refers to is that the women were rejecting sociocultural appearance ideals, that these photoshopped, airbrushed images are not realistic or attainable. So that was a way that women were able to some degree to protect their body image. A second theme that emerged through the cancer experience is that women had learnt to become more open to listening to the signals of their bodies. So for example, when their body needed rest or to be cared for. And that was related to the third theme, that not only were women more attuned to their bodily needs, but they were more able to respond to those bodily needs. And they found that they were more compassionate towards their bodies and caring for their bodies, but also had become more self-compassionate in general, and that was helpful. These kind of caring and compassionate responses to their bodies were certainly aided, the women said, by having care and positivity from those around them. So from positivity from family and friends was really a vital component in women being able to sustain a positive body image. And then another theme that emerged was this notion of priorities in life. So the most important thing is being alive. And this theme referred to women strongly focusing on the fact that they had managed to survive their cancer, and that far outweighed any impacts that the experience had had on their appearance. And the last thing that emerged was this notion that my body functions to allow me to do what I need to do or want to do. So here the notion was that the women had shifted from a solely or primarily appearance focus to one on body function, so that they could appreciate all the ways their body enabled them to have a rich and meaningful life. And we also know that there are treatments available, interventions that are known to support body image enhancement, including amongst those with a chronic illness. The most evidence-based approach in this context is cognitive behaviour therapy. It aims to provide people with information and to teach people skills that they can use to manage their unhelpful body-related thoughts and behaviours. Traditionally, the focus of CBT has been on negative body image, but as Kristen alluded to before, increasingly the focus is also on enhancing positive body image. If we just focus on negative body image, we might help to get people to a place where they feel less negative or at best neutral about their bodies, but we actually want people to have actively positive relationships with their bodies. And so some of the aspects that a positive body image intervention focuses on are things like building body appreciation, or this sense of gratitude, building a sense of body acceptance, even if we're not entirely satisfied with all parts of our bodies, this notion of broadening out how we conceptualise beauty, how we understand beauty, so that it's more inclusive of the diversity of body shape and function, but also appreciating that beauty isn't skin deep, that it's really much more about a person's inner qualities. And another example of something that would be targeting a positive body intervention is this notion of learning to filter information in a body protective manner. So learning to genuinely receive positive body information, to reject negative body information, or if not to reject it, then to at least just allow it to be there without it derailing our capacity to engage in valued activities. For example, you might really love swimming, but not particularly like the way that you look in a swimsuit. But this would be allowing those thoughts to be there and still doing what you love. So we'll give you a little taste of a positive body image intervention towards the end of today's webinar. For now, I'll hand you back to Kristen.
Thank you, Liz. So we wanted to share some of the work that we have happening within the Research School of Psychology here at the ANU in an effort to better understand body image within individuals with chronic illness, but also body image outside of that, in an effort to really promote awareness about body image in the community so that we can support people to get the help that they need and to build a positive relationship with their body. So some of the work that we have that's happening at the moment, which is quite relevant to the work in chronic illness, is really trying to address some of the gaps that we see in the literature around chronic illness and body image, but also to help us improve service delivery and help us enhance services to better address body image in the care of people with a chronic illness where we can. So we wanted to share just a couple of snapshots of studies that are happening right now, and hopefully over time we'll be able to provide some updates on some of the insight we're gaining from this work. So the two first projects we wanted to highlight are really about improving the way that we measure or assess body image in research, both for adults with a chronic illness and a range of different illnesses, but also in general. And one of the ways we're doing that is really trying to address the way we assess body functionality in research. So compared to the appearance component of body image, there's much less work that's been undertaken in body functionality. And there is evidence, particularly in adults with a chronic illness, that concerns around functionality might be particularly important. And what makes it challenging to undertake research in this area is we don't necessarily have a lot of measures available that assess function broadly. So most often the measures will assess specific components like physical ability or health, but not necessarily the breadth of functions that our bodies perform in our daily life. And so we're currently actually just finalising data collection for a study where we're trying to assess a measure that helps us get a more comprehensive assessment of functionality across different aspects of function, but also across different dimensions. So the dimensions that we talked about earlier, including evaluation and investment, but also other components like trust in the body, which has been shown in chronic illness populations to be something that we should be paying attention to, as Liz identified. So we're trying to actually improve that so that we can get a better understanding of what might be impacted in adults with a chronic illness around body functionality, but more broadly in the community, how body functionality might relate to health and well-being so that we can target it more effectively in programs to promote positive body image. The second study, which is related to this, is actually about trying to enhance the way we might measure body image within clinical or healthcare settings. So there is some evidence that patients with cystic fibrosis, where we know that body image can be negatively impacted, actually want to talk about body image in their consultations, but may feel uncomfortable raising it because it is quite a personal issue. And in this particular study, there were some really interesting findings around how health professionals might feel about raising it. So they may feel reticent to raise a really personal issue like body image because they don't want to do that at a time that a patient may not feel comfortable. So what we wanted to do is to develop some really brief measures that we could use in clinical settings to to both get an assessment of how people are travelling around body image, whether they're experiencing negative body image and whether that's impacting their life, but also to help facilitate these conversations and get people some support around body image if it's a concern for them sooner rather than later. So we're also currently finalising our data collection to assess this measure, and hopefully we'll have something available soon that we're able to then test out in healthcare settings to see if we can assess negative body image more regularly in those contexts. The large study that we have running at the moment, which is what this webinar actually forms part of, is our Building Positive Body Image program. So we're really excited to have this program running. We're currently taking expressions of interest from individuals in the ACT who might like to participate in a group program to promote positive body image. And those with a chronic illness who are adults in the ACT are very welcome to contact us if they would like to get more information about the program, or to register interest in taking part in the program. And this also is associated with our webinars where we're trying to promote community awareness about body image and chronic illness, but also we'll be undertaking some health professional training sessions later on in 2023 as part of this broader Building Positive Body Image program. And so again, we would like to acknowledge the support of the ACT government under the ACT Health Promotion Grants program. It's a really exciting program, and this is us trying to address some of the gaps that we see and provide some more options for people to promote positive body image in those who have a chronic illness in the Canberra region. And the final project we just wanted to acknowledge, which is associated with the webinar tonight, but associated with our work in the Building Positive Body Image program, is trying to get a better understanding in the community of what people know about body image in general, and how that might help inform education efforts to promote a better understanding of body image and facilitate support for people who might be struggling with issues relating to both appearance and or the functionality of their body. And so there's quite a number of projects that are running that we just wanted to acknowledge that are delivered by students here within our school that are really focusing on recognition in the community about negative body image in particular, and how we might try to improve knowledge and awareness in the community moving forward. So that gives you just a little bit of a snapshot of some of the work that we have happening at the moment, and we're very open to feedback or suggestions from the community around what might be some gaps or areas for us to be thinking about as we move forward with our research, particularly with our Building Positive Body Image program. And I'm going to now hand back to Liz, who's going to share one simple strategy with you.
Thanks, Kristen. So we just wanted to wrap up by, as Kristen said, to share a positive body image strategy with you. But we should make clear that no one size fits all when it comes to improving body image strategies, and interventions are very much need to be targeted for each specific individual and their unique body image concerns. But we're going to show you a little video, and the strategy that it's teaching is to encourage a shift from a predominantly appearance focus to one on appreciating the body's functionality. And there's evidence supporting the effectiveness of this type of approach for improving body image, including just some preliminary research on its benefits in people with a chronic illness, for example, so rheumatoid arthritis. And the video is called, next slide, thanks Kristen, Relating to Our Body from the Inside Out. And the reason that we've called the video that is that we're encouraging people to shift from an objectified relationship with their body, where they're viewing their body from the outside in and critiquing it and seeing it as an object to be manipulated, to experiencing one's body from the inside out. What is it that my body allows me to experience and do in order to have a rich life? It's actually a video that's part of the Mindseed series that's from the ANU College of Health and Medicine. These are a series of videos that are aimed at enhancing well-being. The video has quite a, it's a light touch, it's a light-hearted approach to improving body image, but it's not a superficial one, and it's not a lightweight approach. In fact, learning to develop this skill of functional appreciation and gratitude can actually have quite profound consequences in people's lives. So it goes for about 5 minutes.
Hello, I'm Katina, a a registered psychologist and PhD candidate at the Australian National University. I'd like to talk to you a bit about body image concerns and some things you can do to improve your body image. Let's get started. Take a moment to think about the last time you looked in the mirror. What did you see? How did you feel? I wonder if you thought about all the things your body can do. Chances are this isn't what you were thinking about at the time. We tend to forget these things because so often we're caught up in focusing on our appearance and usually what we don't like about ourselves. If we think about all the focus and attention on what we look like every day, such as in the media and all around us, this is not surprising. Often, this can have a negative effect on how we feel about ourselves because we might compare our bodies to unrealistic ideals and start to look at our body from an outsider's perspective and focus on our bodies as objects that just aren't good enough. The interesting thing, though, is that when we focus on all of the things our bodies are capable of and what this enables us in our life, studies have found that it can help us to feel much better about our bodies and ourselves. Researchers have asked people to identify what their bodies allow them to do. That is, what functions our bodies perform to help us experience a full life. They found that our bodies perform a wide range of functions that contribute to our lives in meaningful ways. Our bodies help us to experience the world through our senses by seeing our loved ones smiling at us, smelling fresh coffee in the morning, tasting our favorite foods, hearing our favorite music, feeling the warmth of a cozy fire on a cold winter's night, and feeling emotions such as joy or fear and sadness, which are all important to help us understand our needs and experiences. Engage in physical activity and movement, feeling elated after a run, jumping with joy, having a good stretch, which can give us a sense of relaxation, feeling the childlike joy of riding our bike, enjoying a sense of community when playing team sports like soccer. Maintain good health by undertaking important internal processes, such as digesting food, healing from a wound, or grieving. Express ourselves in creative activities such as dancing, painting, singing, writing, or photography. Look after ourselves and complete our daily routine, like eating, drinking, sleeping, or having a hot bath. Communicate with others through our body language, smiling to let people know we're well, or being teary when we're distressed and could do with some support. And deepen our connections with others by giving or receiving a hug. While we all come in different shapes and sizes, what we all have in common is the fact that our bodies allow us to do amazing things so that we can live a life full of diverse activities, engage with and experience the world around us, and build meaningful connections with others. So the next time you look in the mirror, take a moment to ask yourself, what has my body done with or for me today? And how does this enrich my life? You may even want to write this down as a way of reinforcing this information. Putting a post-it note on the mirror or using some other reminder could be helpful in reminding you to practice this strategy of focusing on all the awesome things your body does for you. I hope you enjoy this activity to get used to focusing on all the amazing things your body can do. If you'd like to learn more about relating to our body from the inside out, please have a look at the following resources. If this video brings up any difficult thoughts or feelings for you, or you just need someone to talk, please consider getting in touch with your GP or any of the other professional organizations. This has been a Mindseeds video brought to you by the College of Health and Medicine at the Australian National University.
And we're just going to hand over to Jane now, who's going to talk about some support options.
Yeah, so at the moment, I guess we hope that you found some of the information in the webinar helpful. But just wanted to put it out there that if you would like more information on body image, or you want to still seek further support, we just have the following resources listed available that you can have access to. So as we briefly mentioned, we are currently recruiting for our group program. So, if you are interested, or if you know somebody who might be interested, don't hesitate to contact us for more information at the ANU Psychology Clinic, and the number's just listed there. I guess for support in just managing chronic conditions and mental health, please do seek general practitioner first. There's also the APS, or the Australian Psychological Society, that has a Find a Psychologist service. And that might be helpful in trying to find psychologists who's more specialized in certain areas. There's a Butterfly Foundation for more information on body image and eating disorders. They also have a support line that's listed on their website. Please also visit National Eating Disorders Collaboration, again, for more information on body image and eating disorders. And finally, if you would like to take a look into self-help resources on eating disorders, on body image, or other mental health concerns, there's a Centre of Clinical Interventions, and the website's just listed there as well. And in regards to just general mental health resources and support, there's a Mind Spot Clinic, which has assessment and treatment for stress, anxiety, depression, OCD, and chronic pain, and a lot more, so do visit their website. There's of course Beyond Blue for mental health support, and Headspace for young people from ages 12 to 25. And finally, if you are in crisis or in the case of emergencies and you're located in the ACT, please contact Access Mental Health. And the hotline is a 24/7 one, so the phone line is just listed there. There's Lifeline, and also suicide callback service. And as well, in a case of emergency, don't hesitate to phone 000. So I guess that sort of concludes our webinar content for today. And we're now open for any questions. We have approximately 10 minutes to answer any sort of questions you might have. So please pop it into the Q&A box. If the Q&A is not working, feel free to use the chat box too, and we could also take a look into the questions that come up. So we do have one question so far. I think Kristen or Liz, you might want to answer this. If I'll sort of say it first and then see who wants to answer it. So there's a question here that says, body functionality does seem really helpful in shifting the focus away from appearance concerns. So how effective do you think sort of focusing on functionality will be in chronic illnesses that severely impact or impair the functioning of the body and might cause high levels of disablement or disability? And even in illnesses that might reduce sort of dependability, for example, like chronic fatigue, fibromyalgia. Will this approach be suitable or be effective? Or will the support kind of to appreciate functionality need to be more intensive? So what are your thoughts about how effective this approach might be in focusing functionality for severe illnesses that might impact that?
Kristen, do you want to go first, or do you want me to?
I'm happy for you to go first. I can add if you'd like it.
It's a great question. So again, one size may not fit all, and so you might try this technique and it doesn't work for you. But I would think for the vast majority of people it will be helpful, even if they're undergoing quite substantial functional changes, because the reality is that for most conditions, most of the pre-illness bodily functions remain intact. And it's understandable that our focus has gone to what we can no longer do, but this technique is encouraging people to also shift their focus and appreciate what their body still can do, even in the context of a chronic illness. But I would say that the technique, the timing of this technique, and probably indeed all body image enhancement techniques, is critical. I think they would be ill-timed if we tried to improve body image in the early stages of diagnosis or functional change, when people need that period to adjust and possibly to grieve the changes and the losses that they've experienced. And it could be quite invalidating to try to use body image enhancement techniques at that point. So it's more worthy of intervention when the body image distress has a kind of stickiness or stuckedness about it that's impairing the person's capacity to function in life and their well-being. So I think the timing of interventions such as this is important in terms of whether they're likely to be effective or not. Kristen, I don't know if you want to add anything.
Yeah, I agree. I think it's a wonderful question, and I think Liz has provided a really lovely, comprehensive response. The one thing I think probably to add around the functional appreciation, so the strategy that we highlighted is based on a sort of program, so it's called Expand Your Horizon, and it's been tested in women in particular, but it includes women with rheumatoid arthritis, so it has shown benefits in its evaluation in a population with chronic illness. I guess the one thing to add around its implementation is it is more intensively implemented in that particular program. So exactly as you note, repeating the focus on functionality over time is really important. And the way that program works is they do writing tasks at regular intervals over a week, and then they sustained benefits at 1 week and also 1 month later. So it's a really emerging area. It's only really the last 5 years that this has started to get attention. So there's much more work to be done. But I fully support Liz's response as well, being able to appreciate all of the things the body can do, even with some areas that may not be working to the extent that somebody might wish, can be beneficial. And there is evidence in qualitative research that people with significant difficulties around functioning still do and can identify areas of the body where they are grateful for the functions that they're able to maintain or what they're able to do. And I agree too with Liz around the timing of those interventions. And if somebody's really struggling, more intensive interventions may be required. So CBT includes components around appreciating the body and developing a positive relationship with the body and addressing sources of distress like critical thoughts around the body or behaviours that might be negatively impacting somebody's body image and well-being more broadly.
Thanks, Liz and Kristen, for answering that really comprehensively. We do have another question here asking about body image. So I think, Kristen, you might be able to take this one. So someone wondering if salience is another component of body image. For example, how much time is spent focused on either the function or the appearance dimensions of body image. So I suppose whether you want to take that or whether you want any clarifying.
Sure. No, I'm happy to take that, and Liz may want to add to this too. Salience is absolutely an important part. I think salience most likely would align with our investment dimension. So investment very much includes the sort of importance of the body, either appearance and or functionality to ourselves, our life, and our self-worth, and often is reflected in things like the amount of time somebody spends thinking about their appearance, for example, the amount of time they might spend trying to change the body or grooming. So it's not to say that grooming is a problem, but if it's taking up really large parts of somebody's day and impacting on their other activities, it may be problematic. and that applies to appearance and function, although there's much less work available in the function space. And one of the things we're trying to address with our functionality measure is to get a better understanding of that investment component. So it is really important. It's under-researched compared to the evaluation component. And what we do see in some studies is if somebody has a really high level of investment or salience in terms of appearance in particular, in the way they evaluate their self-worth, that can be a risk and make them more vulnerable to negatively viewing the body, engaging in problematic behaviours like disordered eating behaviours, and in some instances other negative outcomes as well. So we talk about that as sort of an investment in the body that's overly invested in appearance as an example of that can then lead people to be more at risk in terms of their negative body image and its consequences. And so certainly an intervention, that's an important target. So both how you feel about your body, but also the way you sort of cognitively and behaviourally invest in the body as well. And perhaps Liz, you might want to add more to that as well.
Terrific, Kristen. The only thing I would add, and it's a great question because body image salience importance is so central. But a lot of the focus is on body image overinvestment, over salience. But in positive body image programs, it's kind of about finding the sweet spot, avoiding the twin pitfalls of overinvestment, but also underinvestment and neglect, so that people aren't engaging in caring behaviours towards their bodies.
Thanks for answering that question, Kristen and Liz. So I guess we do only have sort of 1 minute left. And I guess, you know, of course, if there's any other further questions, please don't feel free to contact us via email with your questions, and we'd be happy to chat further. But yeah, we also would appreciate your feedback and suggestions about the next webinar. So that link is below, and yeah, will be posted in the chat.
So thank you, Jane. On behalf of all the participants tonight, I'd really like to thank Liz, Kristen, Jane for a really interesting, fascinating webinar on a very vitally important topic. And on behalf of all the participants, I'd like to lead a digital round of applause to you all. And on behalf of Liz, Kristen and Jane, I'd like to thank all our participants this evening in the webinar. As Jane said, we've been recording this webinar. A link to the recording will be made available in due course. It'll be available on the ANU Psychology YouTube channel. And we really would like you to offer any suggestions for content or form of delivery of future webinars in this area. So thank you everyone for attending, for your attention. Take care and good evening. Thank you.
Thanks everyone.